Good evening. Cancer has long been viewed as a disease that mostly affects older adults. But doctors and researchers are now paying close attention to a troubling shift. More adults under 50 are being diagnosed with cancers that were once considered more common later in life. This trend is especially visible in colorectal cancer, but it is not limited to one disease. Researchers have reported rising rates of several early-onset cancers, including cancers of the bowel, kidney, pancreas, thyroid, uterus, and other organs. The exact causes are still being studied, but experts increasingly point to a combination of factors, including diet, excess weight, physical inactivity, alcohol use, environmental exposures, and changes in the gut microbiome. One of the strongest concerns is diet. Modern diets are often high in ultra-processed foods, processed meats, added sugars, refined carbohydrates, and unhealthy fats, while being low in fiber, fruits, vegetables, and whole grains. Research on early-onset gastrointestinal cancers has linked rising disease burden to dietary patterns involving low fiber intake, high processed meat consumption, and high sodium intake. For the digestive system, this matters because diet directly affects the gut microbiome, the community of bacteria and other microorganisms that help regulate inflammation, digestion, and immune activity. Scientists are now studying whether long-term disruption of the gut microbiome may help explain why colorectal and other gastrointestinal cancers are appearing earlier in life. Obesity is another major factor. A recent study in England found that obesity is likely playing a key role in the rise of cancer among people ages 20 to 49. Researchers linked excess weight to increases in several cancer types, including bowel, ovarian, thyroid, kidney, and pancreatic cancers. But they also warned that obesity alone does not explain the full trend, meaning other exposures are likely involved as well. Sedentary lifestyles may also be contributing. Long hours sitting at desks, reduced physical activity, more screen time, and less daily movement can affect body weight, insulin regulation, inflammation, and hormone balance. Over many years, those changes may increase cancer risk. Alcohol use is another significant concern that researchers are monitoring closely. Even moderate drinking has been linked to higher risk for several cancers, including cancers of the breast, liver, colon, and throat. Smoking remains a known cancer risk as well, although researchers note that smoking trends alone do not explain the increase in early-onset cancers. Environmental exposure is another area under investigation. Scientists are studying whether pesticides, air pollution, industrial chemicals, plastics, endocrine-disrupting compounds, and other exposures may play a role in cancer risk earlier in life. A recent report highlighted research into epigenetic changes linked to diet, tobacco, and pesticide exposure in colorectal cancer among people younger than 50. The important point is that researchers are not blaming one single cause. Early-onset cancer is likely rising because of multiple pressures that begin early in life, including childhood diet, antibiotic exposure, obesity, pollution, reduced activity, disrupted sleep, and long-term changes in metabolism and immunity. Doctors are also concerned that younger patients may ignore symptoms or have them dismissed because cancer is not expected at their age. Warning signs for these early-onset cancers can include unexplained weight loss, blood in the stool, persistent abdominal pain, changes in bowel habits, unusual fatigue, ongoing bloating, unexplained bleeding, or a lump that does not go away. Experts say prevention should start earlier, not later. That means eating more fiber-rich foods, vegetables, fruits, legumes, and whole grains, reducing processed meats and ultra-processed foods, maintaining a healthy weight, limiting alcohol, staying physically active, avoiding tobacco, and seeking medical advice when symptoms persist. Regular screening is also an incredibly important tool. In many countries, colorectal cancer screening now begins earlier than it once did, and people with family history or symptoms may need medical evaluation before standard screening age. The rise in early-onset cancer is still being investigated, but the message from researchers is clear. Cancer prevention cannot wait until old age. The habits, exposures, and diets of childhood, adolescence, and early adulthood may shape cancer risk decades earlier than many people realize. This has been your Health News Update. Early detection matters, prevention matters, and persistent symptoms should never be ignored, even in younger adults.